Rika, and my cancer is sarcomas, and I'm with
Faith.
And what major are you?
Health sciences.
Great. Do you know what a sarcoma is?
It's like a cancer, type of cancer.
Yes. So it's like a connective tissue and like bone, like a muscle cancer. Have you ever met anybody that has had sarcoma before?
I have not.
Do you know how to detect it?
I do not.
Okay. So like a lot of people, if they don't have like family members or like a family history of sarcomas, there's not really a screening test, which is like very different than other cancers. But there is like, if you do have lumps and especially in your arms and your legs where it's most common, then that's the easiest place for you to check it out and inform your doctor.
Okay.
Cool. Thank you so much.
Thank you.
And I'm with
Cameron, a mechanical engineering student.
Hey Cameron. Thank you for agreeing to be a part of our interview.
No problem.
Okay, so do you know what sarcoma is?
No, I do not.
It is a cancer that starts in tissue and in your bone. Have you ever met anybody with sarcoma before?
No, I don't believe I have.
So it's actually really different from other cancers because for this one, a lot of people don't have, there's not really screening for those who don't have a family history of sarcomas. So then if you do have sarcomas, it's very typically found in your arms and your legs, and it's more so like by lumps that you detect it by. And if you do find one, then you have to report it to your doctor as soon as possible. So what do you think about that?
No, that was very interesting.
Thank you so much for agreeing to our interview. Thank you.
Thank you.
Hi, my name's Sarah, and I had cervical/ovarian cancer. What's your name?
My name's Maddie. I'm an environmental studies and economics major.
Perfect. So, at what age are females recommended to go to the gynecologist for screenings?
It's like 14.
So actually the age of 21, but getting ahead is not bad.
Yeah, my
Okay,
bad.
so can you name any symptoms of ovarian or cervical cancer?
Pain in your uterus?
Yes.
That's all I can think
That's
of off the top of my head.
That's good. Also, bloating is one of
Bloating?
them.
Okay,
And also,
okay.
you'll tend to have a really full feeling in your stomach, like you'll not want to eat.
I see.
So,
Okay.
Perfect. Thank you for being part of the interview.
Of course. Thank you.
What's your name?
Caitlin,
And what's your major?
biomedical sciences.
Okay. Do you know what percentage of ovarian cancer cases are diagnosed at an early stage?
No, but do I guess?
Yeah,
Okay.
you can go ahead and guess.
What percent? I don't know, like 20?
That's actually right. So only 20% are diagnosed at an early stage, and ovarian/cervical cancer is one of the hardest to diagnose.
Okay.
So do you know the best method to detect for ovarian or cervical cancer?
Best? No.
So
But
that's
no.
okay. The best method to detect is through the HPV test or getting a
Okay.
pap smear at your gynecologist. So
Okay, cool.
thank you so much.
Oh, no problem.
I'm Mary Nicholas, and my cancer is melanoma, and I'm with
Jaden.
and your major is?
Psychology.
Cool. Okay, so do you know what melanoma is?
Yeah, I think it's a cancer that affects the skin, pretty much.
Yeah, it's the cancer that is the cells that give you the color of your skin. It's when they begin to grow uncontrollably. So do you know a way you can detect melanoma?
I would say probably just observing your skin over the years, checking for any sort of unnatural coloring, maybe.
Yes. So another way you could do it is by the ABCDE rule, which A would be asymmetry, B would be like the border of like a mole or a birthmark or something, C would be color of it, D would be diameter, so if it gets any bigger or just a weird kind of shape, and then E would be evolving if it starts to change color, size, or anything like that. So, cool.
Thank you.
I'm with,
Isaac.
and your major is?
I'm gonna declare in chem.
Oh, cool. Okay, so do you know what melanoma cancer is?
Yep.
What is it?
It's skin cancer.
Yes, it's the skin cancer of the cells that give you the color on your skin when they begin to grow uncontrollably. Do you know how to detect for melanoma cancer?
If you see any like dark spots or like colors that are like changing shape on your skin, you can get it checked out by a doctor, right?
That's one way. Another way is by the ABCDE rule, where A would be asymmetry, B would be the border of a mole or birthmark, C would be the color, D would be diameter, and then E would be evolving if it changes in color, shape, or size at all. So thank you.
Yep.
Hi, I'm Stephanie, and my cancer is testicular cancer. What's your name?
I'm Thomas.
Okay, what's your major?
I'm doing hospitality management.
Nice, nice. I'm going to ask you a few questions about testicular cancer. Do you know the age of detection?
I have no idea.
It's between 15 and 35. Do you know any symptoms of testicular cancer?
I also have no idea.
Okay, so you'll feel a lump or a bump around your scrotum, or you're going to have a pain in your abdomen or groin.
Okay.
How's that sound? Is that interesting?
I'm that sounds interesting. Luckily, I don't think I've felt that, so.
That's good, that's good. All right. What is your name?
I'm Derek. I'm a civil engineer.
Awesome. Okay, I'm going to ask you some questions. Is that okay?
Yeah, of course.
All right. Do you know the age of detection for testicular cancer?
The age?
Yes.
It's pretty young, I've heard. It's usually in the mid-20s.
Yeah, it's like 15 to 35 actually.
Oh, okay.
So, do you know any symptoms of testicular cancer?
Actually, yeah. There can be weird lumps as well as issues with their thyroid and no, never mind the last one. No.
No?
Those
All
are
right.
the only two I know.
I'm going to give you one more. So, you'll have pain in your abdomen or groin.
Okay.
So, that is also a detection. How do you think of that?
I will keep that noted.
Okay, awesome. Thank you.
Hi, I'm Bella Jean, and the cancer that I researched was breast cancer, and I'm with...
D'Eve Mendez.
And what's your major?
Computer engineering.
Ooh, smart. Okay, I'm going to ask you a few questions. Do you know the most common symptom of breast cancer?
I don't. Is it lumps?
Yeah, so it is lumps, although some lumps do not have to be cancerous. They are painless, they're hard masses with irregular edges, and those are more likely to be cancer. Do you know any of the screening tests that you might have to get in order to detect breast cancer?
Mammogram?
Yeah, that's exactly right. You can also, if you have a family member who has had breast cancer in the past, you can get a genetic test and look for the BRCA gene, and also is chest radiation as well. So yeah, thank you so much.
Yeah, my pleasure.
I'm with
Gabriela Ramos,
and your major is
mechanical engineering.
Another engineer, smarty pants. Okay, so do you know what age you should start getting clinical examinations, which means mammograms or in-office MRIs for breast cancer?
I do not know.
So the age you should start getting clinical screening is the age of 30. And the age that you should do self-examinations at home should be right around puberty or whenever a menstruating person gets their first period. Do you know the most common symptom of breast cancer?
I would say I'm between two.
Okay.
So either like the lumping or like discharge.
Yeah, no, exactly. So the most common is a new lump or mass. Although not all lumps or masses are considered cancerous, they're most likely going to be painless, hard masses, irregular edges. Discharge is also a big one, as well as skin dimpling, nipple retraction, swollen lymph nodes under the arms or the collarbone. Thank you so much.
My name is Ty. My cancer is non-Hodgkin's and Hodgkin's lymphoma, and I'm with
Graham Fisher. I'm a mechanical engineering student.
Awesome. Do you know the difference between non-Hodgkin's and Hodgkin's lymphoma?
I do not.
The difference is just the area where the lymphocytes are being affected. Generally in non-Hodgkin's, they're more physically appearing, as in you could see like the swelling of your lymph nodes, whereas Hodgkin's, it's not as prevalent. Do you know the age at which it starts to develop?
It's pretty young, isn't it?
Yes, it's about 15 to 19 years old is when it starts to develop. And do you know if it's more prevalent in males or females?
That one's males, right?
Yes, that is correct. It's about 1 in 42 males are likely to get it, and 1 in 52 females are likely to get it. And do you know the signs that are typically present when you have lymphoma?
No, I do not.
Generally just swellness in the lymph nodes, like I said previously, as well as loss in appetite, fever, and a bunch of other symptoms that come with it. So now, do you think you know a little bit more about non-Hodgkin's and Hodgkin's lymphoma?
Yes, I think I do.
Awesome. And I'm with?
Sean Hogan. I'm a computer science major.
Awesome. Now, I have a few questions. Do you know the difference between non-Hodgkin's and Hodgkin's lymphoma?
No, I do not.
No? Well, the difference between them is just the area of which the lymphocytes are being affected. And non-Hodgkin's, it's more prevalent in like more physical areas like underneath your chin, and you can see the difference. Whereas in Hodgkin's lymphoma, it's just underneath cells that are lymph nodes.
Okay.
Okay. Do you know the age in which they typically occurs to get lymphoma?
Any age, right?
It's typically around the age of 15 to 19 is when it's developed.
Okay.
Yeah. Do you know if it's more prevalent in males or in females?
Males.
It is more prevalent in males. It's about 1 in 42
Well,
males that
that sucks,
get
I'm sorry.
lymphoma, and 1 in 52 females, and it does suck.
Yeah.
Do you know the symptoms that come with lymphoma?
Growth of an area, right?
Yeah, so typically you can either see a growth of your lymph nodes, depending on the type of lymphoma that you have, and you could have loss of appetite, fever, and a plethora of other symptoms.
Okay.
Yeah. Do you understand and know more about lymphoma now?
Yeah, I do. Thank you. That was
Awesome.
Great.